Greetings to your viewers. We'll begin by invoking the name of our Lord, who is so merciful and kind. The topic today is depression and anxiety. Unfortunately, this is one malady that is on the rise today. In our fast-paced world, where stress is become so overwhelming, people are feeling depressed and anxious and are showing signs because of loneliness, because of so many factors. And it's only recently that we've accepted depression and anxiety as a medical disease rather than a condition where, because you're weak in the mind. You know, we all thought it was all in the mind only and you made yourself anxious or depressed. But no, now we know for sure that it's a neurochemical imbalance in the brain. And this imbalance is just like any other medical problem, like diabetes, which is an insulin problem, or hypertension. We don't even know why it happens. So this is one of those things that could happen to anybody. So don't feel that you're immune. It can happen to any time of your life, any age group, and it's very debilitating. It's a feeling of impending doom. That's how they describe depression. And you never understand it until you're one of those who goes through it. A big question comes to our mind. Why does depression happen on this person or this lady who was so normal and so vibrant, and suddenly now she's showing all the signs of depression or anxiety? Why does it happen? Yes, some triggers do start this, like going through traumatic events like a divorce or war or a financial catastrophe. Something may trigger this, okay? So the triggers do help facilitate the manifestation of this disease, which is a neurohormonal imbalance. And medications help that, psychotherapy help that. So that's a good question that will arise in everybody's mind. Why does it happen? The triggers are one thing, but we can mitigate it with the social contact, with if somebody is going through hard times and is a friend of yours, be a friend. Reach out, be there, help out. Maybe you will stop this person from going into a depressive state because of the hard times they are going through. So one of the biggest problems about depression is for a person to accept that he or she is having depressive symptoms. They feel everything else is bad, the world is falling apart, or their friends and family are against them, are not with them, and they feel it's not them. It's other people who have changed and who are bad. So the biggest thing is recognizing, and the family members, friends, co-workers will recognize this, and they can be of great help to make you understand that, look, you're not the same person you are changing. Anxiety attacks can happen to the CEO or a guy who sleeps under the bridge. It could happen to anybody, and they're very debilitating, those anxiety attacks. Is recognizing. I will not go into the medical treatment, but how do we avoid this? And one of those things is that we used to live in an inclusive society where 2-3 generations stayed together. You grew up in a village where everybody else had a supportive system. That support system has gone. People are living alone. People are feeling isolated. And there is a lot of despair about economic conditions, about social conditions, politics, and warfare, and all those looming problems that can be exaggerated in the mind. You know, you can look at a problem like it's just a molehill or make it a mountain out of it. So that is your own doing in a way. But why do you get depressed and you get the neurohormonal imbalance? We don't know yet. But we know how to treat it with psychotherapy, with medications. There are a lot of good medications now. In the olden days, we had medications, we had debilitating side effects. But now we have medicines that are very tolerable and they do a great job. So there are a lot of facilities, medication, and support facilities available if you avail it. So the biggest problem is to become aware of your problem and to accept it and to seek help. So I request all your viewers to become aware that the mind can be functioning differently from it was before. And if you see these changes in your loved ones, friends, or co-workers, alert them to it in a nice way, of course, and make them feel that there's a problem. And it's not them, but it's just there is a imbalance happening. And once they seek help, especially starting with psychotherapy and then, of course, medications from a psychiatrist, all these modalities help. And truly, I feel that if we as a society are more and more in tune with what's happening around us, so I request you all to become aware of people around you. Many times you've got somebody living next door, you have no idea who they are or what they are. Knock the door, give them some nice things you have made at home, have connection, say nice things to people who you meet on the street. I'll give you a story. You know the Golden State Bridge in California, in San Francisco, it's a great technological marvel, the bridge itself. It's a phenomenal piece of engineering, but it has got a dark history. It's where most number of suicides take place. And one person, young person, most people don't survive. One 32-year-old decided to take his life, and he survived. And when he recovered, and of course he went through therapy, and now he is a recovered depressed person. So he became a spokesman for depression. And he said, if that day I felt so depressed, I felt so despondent that I wanted to take my life. So I went to the bridge. Somebody even asked me to take a picture. I took their picture, gave the camera back, and just jumped over the bridge. But if that day, even if one person had smiled with me, I would have felt some degree of hope. So I want to request all of you not to be stingy, to smile at people. Say something nice to somebody. Maybe that's the only nice thing they heard. Maybe that's the only social human contact they had the whole day. So be generous in your smile and in your contact with your fellow human beings. Be a mercy to the mankind. Thank you.